Introduction. The soft tissues covering the cranial vault form the scalp. Extent of scalp anteriorly, supraorbital margins. Posteriorly, external occipital protuberance and superior nuchal lines. And on each side, the superior temporal lines, structure A, skin B, superficial fascia, connective tissue, C, deep fascia in the form of the epicranial aponeurosis, or galea, aponeurotica, with the occipitofrontalis muscle, D, loose areolar tissue, E, pericranium, blood supply. In front of the auricle, the scalp is supplied from before backwards by the supratrochlear, supraorbital, superficial temporal arteries. The first two are branches of the ophthalmic artery, which in turn is a branch of the internal carotid artery. The superficial temporal is a branch of the external carotid artery. Behind the auricle, the scalp is supplied from before backwards by the posterior auricular, occipital, tortuous arteries, both of which are branches of the external carotid artery. Thus, the scalp has a rich blood supply derived from both the internal and the external carotid arteries, the two systems anastomosing over the temple. Venous drainage. The veins of the scalp accompany the arteries and have similar names. The supratrochlear and supraorbital veins unite at the medial angle of the eye, forming the angular vein which continues down as the facial vein. The superficial temporal vein descends in front of the tragus, enters the parotid gland, and joins the maxillary vein to form the retromandibular vein. This vein divides into two divisions. The anterior division of the retromandibular vein unites with the facial vein to form the common facial vein, which drains into the internal jugular vein. The posterior division of the retromandibular vein unites with the posterior auricular vein to form the external jugular vein, which ultimately drains into the subclavian vein. The occipital veins terminate in the suboccipital venous plexus. Emissary veins connect the extracranial veins with the intracranial venous sinuses to equalize the pressure. These veins are valveless. The parietal emissary vein passes through the parietal foramen to enter the superior sagittal sinus. The mastoid emissary vein passes through the mastoid foramen to reach the sigmoid sinus. Extracranial infections may spread through these veins to intracranial venous sinuses. Diploic veins start from the cancellous bone within the two tables of skull. These carry the newly formed blood cells into the general circulation. These are 4 veins on each side. The frontal diploic vein emerges at the supraorbital notch open into the supraorbital vein. Anterior temporal diploic vein ends in anterior deep temporal vein or sphenoparietal sinus. Posterior temporal diploic vein ends in the transverse sinus. The occipital diploic vein opens either into the occipital vein or into the transverse sinus near the median plane. Lymphatic drainage. The anterior part of the scalp drains into the preauricular or parotid lymph nodes, situated on the surface of the parotid gland. The posterior part of the scalp drains into the posterior auricular or mastoid and occipital lymph nodes. Nerve supply. The scalp and temple are supplied by 10 nerves on each side. Out of these, 5 nerves, 4 sensory and 1 motor, enter the scalp in front of the auricle. The remaining 5 nerves, again 4 sensory and 1 motor, enter the scalp behind the auricle. Clinical anatomy. Wounds of the scalp gape when the epicranial aponeurosis is divided transversely. Because of the abundance of sebaceous glands, the scalp is a common site for sebaceous cysts. Fig. 2.7. Wounds of the scalp bleed profusely because the vessels are prevented from retracting by the fibrous fascia. Bleeding can be arrested by applying pressure at the site of injury by a tight cotton bandage against the bone. Because of the density of fascia, subcutaneous hemorrhages are never extensive, and the inflammations in this layer cause little swelling, but much pain. Because the pericranium is adherent to sutures, collections of fluid deep to the pericranium known as cephalhematoma take the shape of the bone concerned when there is fracture of particular bone. The layer of loose areolar tissue is known as the dangerous area of the scalp, because the emissary veins which course here may transmit infection from the scalp to the cranial venous sinuses. Collection of blood in the layer of loose connective tissue causes generalized swelling of the scalp. The blood may extend anteriorly into the root of the nose and into the eyelids, as frontalis muscle has no bony origin, resulting in black eye. The posterior limit of such hemorrhage is not seen. If bleeding is due to local injury, the posterior limit of hemorrhage is seen.